Matiri from University of Northern Philippines College of Nursing. So today I will be performing a return demo on providing care to the patient with chest tube and changing drainage system. First, assess the patient's vital signs. Assess the patient's respiratory status, including oxygen saturation. Bring necessary equipment to the bedside stand or overbed table. Perform hand hygiene. After performing hand hygiene, put PPE if indicated. Wear a face mask. Go. May I know your name and your age, ma'am?
I am 20 years old.
Okay. Close curtains around bed and close the door to the room if possible. Explain what you are going to do and the reason for doing it to the patient. So hello ma'am, today I will be checking your insertion site and I will change your drainage system. Apply clean gloves. Move the patient's gown to expose the chest tube insertion site. Keep the patient covered as much as possible using a wet blanket to drape the patient if necessary. Observe the dressing around the chest tube insertion site and ensure that it is dry, intact, and occlusive. Check all connections are securely taped. Gently palpate around the insertion site, feeling for subcutaneous emphysema, a collection of air or gas under the skin. This may feel crunchy or spongy or like a popping under your fingers. Check the drainage tubing to ensure that there are no dependent loops or kinks. So, position the drainage collection device below the tube insertion site. So, observe the water seal chamber for fluctuations of the water level in the patient's inspiration and expiration, or the what we call tidalling. If suction is used, temporarily disconnect the suction to observe for fluctuation. And then, assess for the presence of bubbling in the water seal chamber, here. And then, add water if necessary to maintain the level at 2 cm mark or the mark recommended by the manufacturer. And then, next, assess the amount and type of fluid drainage. Measure drainage output at the end of each shift by marking the level on the container or placing a small piece of tape at the drainage level to indicate the date and time. So, the amount should be a running total because the drainage system is never emptied. If the drainage system fills, it is removed and replaced. And then, remove gloves. Assist the patient to a comfortable position. Komportable kami lang?
Yes.
Okay.
Oh.
So, raise the bed rail and place the bed in a lower position as necessary. Remove additional PPE and perform hand hygiene. So let's proceed in changing the drainage system. First, obtain the two padded Kelly clamps. We have here the two padded Kelly clamps. And then, a new drainage system. I have here the improvised one. And then, a bottle of sterile water. So, add water to the water seal chamber in the new system until it reaches the 2 cm mark or the recommended by the manufacturer. So, follow manufacturer's direction to add water to suction system if suction is ordered. Put on clean gloves and additional PPE as indicated. And a face mask. Next, apply Kelly clamps 1.5 to 2.5 inches from the insertion site. And 1 inch apart, going in the opposite direction. So, remove the suction from the current drainage system. Unroll or use scissors to carefully cut away. Unroll or use scissors to carefully cut away any foam tape on the connection of the chest tube or drainage system. Using a slight twisting motion, remove the drainage system. Do not pull on the chest tube. Make sure do not pull on the chest tube. Keeping the end of the chest tube sterile, insert the end of the new drainage system into the chest tube. Let's assume that this is the new drainage system. Remove Kelly clamps. Apply plastic bands or foam tape to chest tube or the drainage system connection site. Next, assess the patient and the drainage system as outlined. Remove clean gloves. and perform hand hygiene. So that's all for the return demo on providing care to the patient with chest tube and changing the drainage system. Thank you!